Thank you very much for staying here. Now, Labour expert Ben Arthur has said the posturing of the doctors as a result of the country's field systems. He's charging the National Labour Commission to intervene by ordering compulsory arbitration between government and the striking doctors.
What the doctors are going through, I'm not here to speak for them, but I'm just giving you as an industrial relations person that it's just a reaction to a system that we have put. The first thing to do is that we need to correct some structural challenges that we have. For example, when it comes to public sector, the pay system of the public sector and the way we implement it, we have to begin to look at it again. The single spine implementation has had its own challenges, and the location and functioning of Fair Wages and Salaries Commission itself ought to be decentralized. We must appreciate that the two parties have failed to negotiate in good faith. They have failed to negotiate in good faith. They must acknowledge that the relevant or the appropriate authority to step in here is the National Labour Commission. And I'm also very sad that they are very, very silent. Of course, they could be silent simply because the bosses have jumped into the fray. The ministers, the president,
the political head.
Yes, so
that makes it difficult.
Definitely, if you are a commissioner on the National Labour Commission as a part-time worker, you have challenges as to authority and what you could do. But the National Labour Commission is mandated under the labour law. Once we have noticed that the parties have failed to negotiate, we have to introduce a third-party intervention, which is the National Labour Commission. They must institute a compulsory arbitration. The arbitral award will be binding on both government and GA.
The Social Welfare Department in Cape Coast in the Central Region is moving to clamp down on some daycare centers. This follows revelations that some daycare centers operate in unhygienic conditions. Correspondent Richard Kojonyako joins us with more on the telephone. Hello, Richard. Good morning.
Hi. Good morning, Kevin.
Now, how bad are the conditions under which these daycare centers operate?
Well, they are so bad to the extent that some operate in garages, in a one-room apartment, and some of the rooms they operate from are not well ventilated. The children are lammed up in these rooms, and those people who care for these children in these daycare centers are not trained. Sometimes senior high school leavers, sometimes senior high school leavers are made to care for these children, and the Social Welfare Department thinks that this is so bad because the formation stages of these children will be badly affected because the people who don't know how to care for the children very well, and when these children, as young as they are, they urinate or they defecate and other things, how they handle them when the child has a cold or some contagious disease, it's going to affect almost all the children. And sometimes they feel that when these things happen, it might not affect the children very early. At a later stages in life, some of these things will affect them. And so that is the point that the Social Welfare Department is raising, that some of these institutions, instead of going to the Cape Coast Assembly for them to be directed to the Social Welfare Office in order to go through the procedures in registering a daycare center so that they can go and check on these places before they can operate, they just pull them up. And the Cape Coast Metro Assembly that is supposed to run the checks, and when they have monitored and brought up their recommendations for them to actually implement by closing down some of these unauthorized structures, they do not mind it. So for a year, 2 years, 3 years, they've been going down this same path, but the Cape Coast Metro Assembly hasn't done anything about it.
So when will the clampdown begin? Richard?
Yeah.
I'm asking when the clampdown begins.
Well, they are now relying on the Cape Coast Metropolitan Assembly to actually close down, because according to them, they cannot of themselves close down these daycare centers, but the Cape Coast Metropolitan Assembly is supposed to close down the daycare centers.
Have we heard anything from the Assembly?
Well, we've made conscious efforts. We went to the Cape Coast Metropolitan Assembly. We went to the Metropolitan Chief Executive's office. We were told he was not there. When we contacted the presiding member of the Cape Coast Metropolitan Assembly, he declined comment. and said that he would want the Metro Chief Executive to speak on it. And when you put up the call does not get any response.
Well, thank you. We'll leave it here. Richard Kujonyako is our Central Region correspondent. Back here in the National Capital, Accra, that is. Today is the deadline issued to managers of government hospitals to ensure the resumption of full operations in all departments. The Health Minister issued that directive at a news conference in Accra on Tuesday. Let's get on the line now and speak to health correspondent Fred Smith on whether the directive is being complied with at the Korle Bu Teaching Hospital. Hello, Fred. Fred. I think we have lost Fred.
Yeah, I'm on the line.
Right, Fred, what can you report from the Korle Bu Teaching Hospital?
Good morning here, and contrary to the directive given to the heads of the various institutions by the health minister, I don't see a resumption of full operations here at Korle Bu Teaching Hospital. The main OPD points, that will be the polyclinic OPD. They are not accepting cases. They are turning away patients. And the other OPDs for tertiary care, they have some patients who need emergency care. There are some doctors actually seeing patients at the surgical department, but I'm told that they're doing this on humanitarian grounds. The hospital administration, I'm told, will be having a meeting today to take a decision on how to respond to the minister's directive. But that meeting hasn't started yet because we understand the chief executive is at the ministry having another meeting before this. And I'm also told that the doctors are currently in a meeting ahead of their meeting with the National Labour Commission.
Very well, we'll leave it here, Fred. Fred Smith is our health correspondent. He joined us from the Korle Bu Teaching Hospital, and he tells us that, well, the directive has not been adhered to yet. The hospital authorities are yet to convene a meeting to decide on what action to take. But some doctors are the surgical OPD, and they say they are working on humanitarian grounds.